the broadcast.
The broadcast is now starting. All attendees are in listen-only mode.
Welcome. Good morning. I'm so glad that you've joined us. We're going to give it just one more minute to let others join the broadcast before we actually start the webinar. So just be a little patient and let others join. Looks like we have a great crowd, Emily. A lot of people joining. So I'm going to go ahead and start. I am Barb Sorum. I am with Minnesota Communities Caring for Children, and you have joined the Minnesota Communities Caring for Children webinar of Reducing ACEs and Building Resilience in Washington State. This will be presented by Emily Clary. She's with Minnesota Communities Caring for Children, and also Lowell Johnson, who is the co-chair of the ACEs Resiliency Coalition in Brainerd, Minnesota. Hopefully you're familiar with how GoToWebinar works. So we will be taking questions throughout the broadcast, and you can either raise your hand or type in your question in the question box, and we will get to them when we're able to do that. So I think with that, you are muted, and if you have questions, if you raise your hand, I can unmute you from this end. Otherwise, I think all the rest is pretty self-explanatory. So I think with that, I'm going to turn it over to Emily. Hi, Emily.
Hi, thank you, Barb. So today, before we actually jump into the content, we want to take a couple of minutes just to do a quick poll to get a feel for who's quote unquote in the room today with us. So if you wouldn't mind just doing the first poll, which really looks at what sector you're most affiliated with, and that looks at a couple of different, so I think the poll is now open. So if you could just fill out which sector you belong to. And if your sector is not listed there, that's okay. You could just check the other box. We'll give it a couple more seconds for you to fill that in.
Okay, it looks like they're finished. We'll close that and share the results.
So it looks like we have a pretty good mix of public health, mental health, schools, and the other. So feel free to add in the question box what your other sector is if we haven't captured it in that list. So the second poll we want to do is to just see what region of the state you represent. We anticipate that most of the people on this webinar are in the state of Minnesota, but if you are from out of state, there's also an option to fill that out as well. All right, just a couple more seconds on that one.
Yep, it looks like we've finished.
So it looks like there's a pretty big group from central Minnesota, which is Lowell's region, which is pretty cool, who is the co-presenter for this. And then some from the southern region, so excellent. And then I think the third poll we're going to do really just looks at your level of familiarity with the ACEs and resilience research, just to get a feel for how knowledgeable people are who are on this poll. And we have 4 different categories: moderately familiar, very familiar, not at all familiar, and slightly familiar. So it seems like most of people are moderately familiar.
Wait, we haven't gotten there.
Oh, I see. Okay. I'm seeing something that you all can't yet, so.
Okay.
Great. So it seems like most people on the webinar have some level of familiarity with the ACEs and resilience research. So that's great to hear. And finally, we just want to see who in the group identifies as an ACE interface presenter or an ACE interface trainer, or if you're connected with your collaborative, because this webinar is supported in part by the ACE Collaborative Project. And so we just want to know who is a part of these groups, if any.
People are deciding. Okay, there.
Great. Okay. So it looks like there's kind of a mix as well of people who identify as those different categories and some who are not at all connected with those. So thank you so much for helping us identify who you are. Today,
I'm just going to share.
Yeah.
I think FYI, we have a group of 6 employees watching together from the Brainerd area. That's from Cassie.
Great. So the purpose of this webinar really focuses on the last 20 years of research that has been emerging in the fields of neuroscience, epigenetics, ACEs research, and resilience. And this cluster of research has become known as the near science. The ACEs research has revealed that there are public health and social risks associated with childhood trauma. And the resilience research carries a message of hope that there are protective factors and strategies that individuals, communities, and systems can adopt to mitigate the harm of ACEs. Community and state leaders in Washington state were some of the earliest adopters of this research, and they've been using near science to inform their practice both at the state and local level for more than a decade. The primary purpose of this webinar is to shed light on some of the lessons learned from community and state leaders in Washington state who have been championing this work over the past decade plus. So my name is Emily Clary, as Barb mentioned, and my role is to work as the Director of ACE Collaborative Partnerships at Minnesota Communities Caring for Children, otherwise known as MCCC. And MCCC is a nonprofit in St. Paul that focuses on the prevention of child abuse and neglect, primarily through parent and community education. That's a big push for the organization. And the reason that I'm here today talking about this is because I published a paper, a professional graduate school paper in 2017 called Walla Walla, Washington's Community Response to Adverse Childhood Experiences, which was essentially a case study and lessons learned from Minnesota based on some of the work that they did out in Washington state. The full paper is linked at the bottom of this PowerPoint, and you'll have access to that if you want to dive deeper into the information about the history and the case study of Walla Walla, Washington. So the reflections and interviews that I conducted, the interviews that I conducted with 9 community leaders from Washington state are really some of the, are what are going to be informing some of the lessons learned that we share with you today in part. And I am also co-hosting this webinar with Lowell Johnson, and we'll let him introduce himself.
Good morning, everyone. My name is Lowell Johnson. I am a retired educator. I worked most of my career in early childhood family education, working both with children and facilitating parent education support groups. In my retirement, I got very interested in the ACEs research, and I become a certified ACE interface presenter. And I'm working under the auspices of the ACEs Resiliency Coalition in Brainerd, Minnesota. And we're affiliated with the Mental Fitness Goal Group of Growing Energized. As I've been going out doing presentations, and I became aware of the incredible successes out in the state of Washington, I started incorporating some of that data into my presentations. And the questions I kept getting from participants was, well, how did they do that? What strategies did they use to achieve these incredible outcomes? So I had a chance to talk with Laura Porter at the Midwest ACEs Summit here a little over a year ago, and she offered to set me up with connections out in Washington State if I wanted to do some site visits. So last June, my wife and I traveled out to Washington, and I was able to talk with leaders in 3 different communities in Washington to find out how did they do this incredible work. So so my piece of this is to relay some of those learnings I got through interviewing folks. And I think the purpose of this webinar is really to get at the hope that we can really change what's happening in our communities and families and drive down the ACEs and build resilience. So that's what I hope you'll leave with.
Thank you all. So I do want to emphasize that Lowell and I are not experts on all of the great activity that happened out in Washington State related to reducing ACEs and building resilience. We simply are going to highlight today a few of the themes that emerged from our interviews with a dozen of the state leaders and local leaders who have been committed to this effort in Washington State. So today we're going to start by framing with a brief overview of the ACE study. We're going to introduce a couple of core components related to the self-healing communities model. We will provide an overview of some of the history related to Washington's ACE response, and then highlight 3 communities that developed a local ACE response. And we'll close with 6 lessons learned from the interviews with those champions of this work. As Barb mentioned, we will be taking questions along the way, and we'll also have an opportunity for Q&A at the end.
So the Adverse Childhood Experience, or ACE study, was conducted back in the 1990s by Dr. Rob Anda and Dr. Vincent Felitti. The genesis of this study was at Kaiser Permanente. Folks were, Kaiser Permanente is a huge healthcare organization in San Diego, California. And they were wondering, why are some adults so healthy and others have so many health problems? And public awareness of mistreatment of children was coming to a lot of attention was being given to that. So they started to wonder, could it be that when children are mistreated, they turn into adults with health problems? So Dr. Felitti and Dr. Anda designed the original ACE study. So the way it worked is they developed the 10 questions, the ACE, the adverse childhood experiences. So those are in the category of neglect, it's physical or emotional neglect. In the category of abuse, it's physical, emotional, or sexual abuse. And in the general category of household dysfunction, it's mental illness of a parent, drug or alcohol addiction of a parent. Did a child witness domestic violence? Was there separation from a parent for a death, divorce, abandonment, or any reason? And then incarceration of a family member. So each of those experiences was considered one ACE. The 10 ACEs questions were embedded in a much longer survey of health. And so they took the individual participants' ACE score, which would be anywhere from 0 to 10, and then we're able to correlate that with all the health data that Kaiser Permanente had collected over the years. There were 17,000 people in the original sample population, which is a huge sample population. And if there was one disadvantage to the original ACE study is that it was done on pretty much white, middle class, pretty well educated folks who had good jobs and good health insurance. So you do need to know that the ACE study has been replicated a number of times across the country, and basically every time the ACE study is done, it comes out with pretty much the same results. So this is the ACE pyramid. So this was a theoretical model that Drs. Anda and Felitti were interested in investigating. So this is a birth to death model. It starts at the bottom with the adverse childhood experiences. So basically, the more ACEs a person has in their life, the more likely the rest of the pyramid will come into effect. The next level is disrupted neurodevelopment. And so probably the most important part about this level is that to know is that when people are under stress, the brain puts a chemical called cortisol into our brains to help us deal with stress. But cortisol is meant to be metabolized in about 20 minutes or less because most stressful experiences don't last more than 20 minutes. So the problem with children growing up in ACEs environments is that they're getting toxic levels of cortisol. So it's too much cortisol going into the brain that disrupts the brain development of children. So what the toxic levels of cortisol actually do is change the architecture of the brain, so the structure and the functioning of the brain. And the other part to that toxic levels of cortisol is that it starts to kill off seedling cells in the brain. So when an infant is born, they have seedling cells that aren't meant to develop till later on in life. So if those seedling cells are damaged because of toxic levels of cortisol, it's correlated with problems later on in life. The next level is social, emotional, and cognitive impairment. So I'll start with emotional. When a baby is born, they're completely helpless. They will die if their parents and caregivers don't take care of them. So what does a baby do? They cry. If the father, the mother, the other caregiver picks up the baby, cuddles it, feeds it, changes its diaper, the baby starts learning that they can trust the world. If they have a need, somebody will take care of them. And so that actually gets wired into their brain. Psychologically, this would be related to trust, that an infant is learning under these best circumstances to trust the world, and trust is the basis for all human relationships. So jumping over to social impairment, everybody wants their kids to grow up with good social skills, but they're actually very complicated to learn. So they involve knowing your own emotional state, being able to read the body language and interpret the words of other people, knowing what words or behaviors you might use. And if you don't have good modeling at home, they're very complicated to learn. So high ACEs children tend not to have high social skills. The other level of cognitive impairment to me refers both to the social emotional function, which very simply could be said to be if a child's worried about what happened to them before they went to school, or worried about what may happen when at the end of school, they're just not as cued into the learning environment in schools. And then the other dimension of that is the seedling cells I mentioned before, that if there are those seedling cells that are, say, help you learn higher math later on are damaged, well, you're just not as ready as other children to learn some of the cognitive skills in schools. The next level of the pyramid is the adoption of health risk behavior. So this would typically happen during the teenage years. So I do work in the Crow Wing County Jail, and in general, if you're a resident of the Crow Wing County Jail, you're a high ACEs adult. And what the folks in the jail have told me that, yeah, they started using, because the addictions are bundled into the ACEs very commonly. They started using when they were 12 or 13. Now, back up a little bit to the neurodevelopment of it. The reason people use is that they're hurting. The high ACEs folks are hurting emotionally for sure, and possibly physically. And when you're hurting, you want to feel better. Society offers lots of ways to feel better. So this is where the tobacco, alcohol, drug use, sex, anything that makes you feel better works momentarily. And the neurodevelopment part of it is that you get a little rush of dopamine in your brain. So it's that seeking for that dopamine feel-good experience through these health risk behaviors that kind of are a problem, basically. They set up for disease, disability, and social problems, and there's a whole range of both physical health problems like COPD and liver disease, a whole bunch of physical diseases, and also mental health issues and social problems that happen at this level of the pyramid. And then up at the very top is early death. So a person with 6 or more ACEs statistically will die 20 years earlier than a non-ACEs person. So this is the pyramid that was investigated and has been proven to be true. So the ACEs are the problem, resiliency building's the answer. So Laura Porter and Dr. Rob Anda have put together what they call the self-healing communities model. And so the resiliency building in this model and specifically ACE interface, sees that there's 3 core protective systems that help people be resilient. The first is individual capabilities. And so there's a lot of terms here that begin the word with self that are involved. So we start off with the idea of self-knowledge or self-awareness. How well do you know yourself? Then there's self-concept, which is the idea about who am I? What is my identity? Who do I think I am? Then you have self-esteem, which is how you feel about who you are. And then that is usually broken down into how you feel about how lovable you are or how capable you are. Then we have self-regulation, which is the idea of when you are experiencing one of the negative emotions, you have ways to soothe yourself. So sadness doesn't turn into depression. But the term that the ACE interface uses is self-efficacy. So self-efficacy is basically the idea of a positive self-view. So if a person believes that their own thoughts, feelings, and actions has a positive impact on their life and the life of others, you have that positive view, that self-efficacy that helps you deal with stressful situations. The next core protective system is attachment and belonging. So this is basically all about relationships. So if there's one key concept that goes with resiliency building, it's relationships. But the important thing is that these relationships need to be with people who are competent and caring. So the caring is, in one sense, kind of the easy part, but the competency. So knowing about child development, knowing about adult development, and having the skills, the interpersonal skills, is very important in this core protective system. The last core protective system is kind of the macro level. So it's community, faith, and culture. So what's a community? A community is made up of lots of individuals, lots of relationships, but communities have offer other things like employment. So what are the employment options? What about faith communities? What about civic groups? What about the school system? So all of these different community level systems have an impact on resiliency building, and communities really vary. Faith is basically the God or higher power question. So people who have a strong sense of faith and higher power are more able to withstand the stressors of life. And then culture is another important macro level protective system. So culture is sometimes thought of race or ethnicity. That can be part of it. Sometimes people talk about culture as being, well, the food you eat, the clothes you wear, the ceremonies you engage in. It includes that. But the definition of culture I like is the way we do things around here. So it's kind of the unwritten rules about how people relate to each other. And to me, the important thing about culture is that it's a dynamic process. It's not set in stone. Cultures are evolving. And one of our challenges going forward is how do we create the kinds of cultures that we want our children and families to live in. And so that's resiliency building.
Thank you. So next, excuse me, I will provide a timeline of some of the decisions that helped to move this work forward at the state level. Given that a lot of the successes that were experienced in Washington State happened at the local level, it's important to note that it didn't happen in a vacuum. And so there were a lot of really great things happening behind the scenes at the state level that contributed to the success of the local level. So if you want to dig a little bit deeper into some of the history, then you certainly can in my professional paper. Again, that's linked to the bottom of this. But this is not going to be a comprehensive look at all of the things that happened in the state, but just a pretty broad, high-level overview. So almost 30 years ago in 1989, leaders in Washington State started wrestling with the question of how do we improve the health of children and families in the state? And so they held 50 focus groups to discuss how to do that and how to transform health in the state. And these conversations led to 2 formative pieces of legislation that are shown in this slide. The first one was the Violence Prevention Act of 1994, which really focused on identifying 7 major social problems that the state wanted to address, including high school dropout, youth violence, family violence, child abuse, neglect, and the related out-of-home placements, substance abuse, suicide rates, and teenage pregnancy. And in order to address these these 7 major social problems, the revised Code of Washington also introduced the creation of community public health and safety networks, which I will call networks in this slideshow or for this webinar. And so basically these networks were localized collaborations that were created to carry out the work at the community level of addressing the 7 major social problems that were identified in the VPA, or the Violence Prevention Act of 1994. And at that time, the Family Policy Council was designated as the primary oversight agency to oversee this work across the state. And so they were a state level entity that really worked with communities to roll this work out. Excuse me. By 1997, a total of 53 networks had been created in Washington state, including 10 tribal networks. And around that time that the networks were forming, the ACE study was simultaneously being conducted in California. By 2002, armed with information about the ACE study, the Family Policy Council, which was that state oversight agency, decided to prioritize focusing on addressing ACEs through the work of the networks. The council encouraged network partners to learn about ACEs and attend statewide trainings about ACEs, and to disseminate information about ACEs and resilience building to their communities, which they hoped would result in the development of community-wide responses to ACEs. Around this time, only about 36 networks were able to continue receiving funding due to some budget restrictions of the state. So by 2005, the Family Policy Council's education director developed a presentation on near science, and a cohort of 40 presenters were trained in the state to spread the information about ACEs to audiences across the state. And from 2005 to 2008, that cohort of 40 people educated over 5,000 people across the state about near science. So in 2009, ACE questions, so those 10 ACE questions were added to the Washington State Behavioral Risk Factor Surveillance System, which is also called the BRFIS. And the BRFIS is a health-related telephone survey that collects state data from residents about their health-related risk factors and behaviors, chronic health conditions, and their use of preventative services. The survey, the BRFIS survey, revealed that 62% of Washington state participants had experienced one or more ACEs. And in light of this survey data, Dr. Robert Anda, who was the co-principal of the ACE study, and a colleague, Dr. Brown, published a report in 2010 that called ACEs, quote, a chronic public health disaster in Washington state. This report sparked new conversations about the importance of addressing ACEs in the state. In June 2011, Washington state then became the first state in the nation to introduce legislation that explicitly was related to ACEs with House Bill 1965. This bill discontinued funding for the Family Policy Council and in its place created the ACEs Private Public Initiative, otherwise known as API. And despite the fact that the Family Policy Council was the strongest state-level champion mobilizing a response to ACEs at the time, the legislature saw the need to expand the leadership of the effort to include foundations and other non-governmental entities to enhance the funding sustainability of this work, which is why they ended up closing the Family Policy Council and creating this new entity of partners. API, that new group, was officially formed in 2012, and its purpose was to study the effective interventions to prevent and mitigate ACEs. One of the primary functions was to facilitate statewide learning and dialogue on these topics, but given budgetary restrictions and changing priorities at the state, the same year that API was established, all of the remaining networks across the state lost their government funding. Only 18 of the original 53 networks were able to sustain their work with alternative funds from foundations and other organizations. So one of API's priorities, despite the fact that all the networks lost their funding, API's priorities at the state level was to evaluate the value of ACEs work in the state. And so from 2013 to 2016, they conducted a report or an evaluation of 5 different communities, 4 of which were connected with their community networks. And they looked at how effective they were at addressing ACEs and reducing ACEs. And the final report from the 3-year study, which was a partnership with Mathematica Policy Research, was released in 2016 and revealed, quote, local community networks in Washington state have succeeded in reducing the effects of adverse childhood experiences such as child abuse and neglect, domestic violence, household substance abuse, and parent mental illness. More information about this report is linked at the bottom of the slide of this PowerPoint as well, so you can dig more into the details of that evaluation. So after the evaluation was conducted, APPE announced that it would sunset at the end of 2017, given that they believed that a local response to ACEs could be better coordinated by communities and their partners at the local level. To date, it appears as though the state-funded portion of this work has dropped off almost entirely, and that community leaders, nonprofits, and foundations are the primary drivers working to address ACEs and build resilience in Washington state today. So next, we want to dig a little bit into 3 different communities that developed their own response to ACEs.
Can I interrupt just?
Yes, Barb, please.
Second? You know, it's my fault. I neglected to mention this earlier, but people are wondering if they have access to your slides. And yes, you do. On your dashboard, your webinar dashboard, if you click on handouts, there is a PDF of the slides right there. You should be able to download and print. Thank you, Emily.
Thanks, Barb. So next, Lowell and I are going to provide examples of how communities in Walla Walla, Bellingham, and Longview, Washington used near-science to inform the practices within their communities and within their community context. So I'm going to start with Walla Walla, Washington. That was the focus of the paper that I did, and so most of the interviews that I did were with people who were championing this work in Walla Walla. Excuse me. So Walla Walla may be the most well-known trauma-informed community in Washington because it captured national attention after the release of the Paper Tigers documentary, which highlights the successes that Lincoln School achieved after adopting trauma-informed discipline practices. This change in discipline occurred when Jim Sporliter, who was the school administrator and principal, attended a conference and learned that punitive discipline practice were really not as effective as he thought they were. When he returned home and back to the school, he told his staff about ACEs and said, you know what, from here on out, my discipline is going to look a lot different. He worked with a consultant who helped him develop a trauma-informed school model. And after adopting the model, the school achieved statistically significant reductions in behavioral issues, suspensions, as well as an improvement in high school graduation rates, among other positive outcomes. So the Lincoln High School is one shining example in Walla Walla of what some of the changes were that came from implementing a trauma-informed approach. But it is important to also note that Lincoln could not have achieved its gains in student outcomes without the partnership and support of many other community agencies in Walla Walla, including the on-site health center. The health center offers an array of services, including primary care, behavioral health services, and referrals for case management for students. And the executive director of the organization, Dr. Stan Leddington, explained that the health center helps students build resilience and learn to self-regulate, in addition to getting their unmet medical and mental health and social and emotional needs met. Additional health center sites have been developed at the elementary school and the middle school in Walla Walla. And the elementary school has experienced a significant decrease in discipline referrals since the center opened a site on site. These are just 2 examples of organizations in Walla Walla that supported resilience building of students in a school setting, which led to improvements in both academic and behavioral outcomes. In January 2012, the Walla Walla County Board of Commissioners made a decision to expand mental health and chemical health services in the county by implementing a sales tax of 0.1%. This pool of money has since provided an ongoing stream of revenue to help sustain the health center's development in Walla Walla, and is an example of an innovative strategy that local government implemented in Walla Walla to help improve the resilience of community members in the county. Another organization, the Children's Resilience Initiative, which was founded in 2009 to bring a cross-section of partners together who could help increase resilience and spread the word about ACEs and protective factors, was developed in 2009 by Terry Barilla, who was also at that time the Walla Walla Network Coordinator. And the Children's Resilience Initiative essentially had two primary goals. The first was to create a community conversant in ACEs, brain architecture, and resilience. And the second goal was to embed those principles into the daily practices of all of the partners who were at the table and supporting that work. By 2014, a survey of community members revealed in Walla Walla that approximately 42% of residents were at least somewhat familiar with ACEs. So they really did get the information out vastly across the community. In addition, a number of organizations also prioritized training their staff and volunteers about ACEs so they could approach their work with more compassion. And those include the Friends of Children of Walla Walla, which is a mentoring program, and the Jubilee Youth Ranch, which is a Christian boarding school located near Walla Walla. These are two examples of organizations that have committed to educating staff and reinforcing practices that promote resilience. The Children's Resilience Initiative also partnered with grassroots organizations in town, including the Commitment to Community. And you'll see on the slide that's currently showing, this is a picture of some of the work, one of the projects they did. And this organization supports neighborhood revitalization and works with neighborhoods to help them develop safe spaces for community members. And this picture shown is just an example of a project that created space for children to play and adults to congregate and build community in town, and shows one example of a project that helped develop and build community infrastructure and support community resilience. And then in October 2013, Walla Walla Mayor Jerry Cummings acknowledged the diligence of all the partners who were working to support the ACE response in Walla Walla and made a proclamation that declared October to be Children's Resilience Month in Walla Walla. This proclamation showed that the local Walla Walla government was also committed to reducing ACEs. And these are just a few of the many examples of how organizations in Walla Walla were able to put information about near science into practice.
Would you remind people what neuroscience stands for?
Yeah, okay.
Neuroscience, the N is neuroscience, the E is epigenetics, the A, it stands for the ACEs, and the R stands for resilience. Okay, so when I visited Bellingham, Washington, it was very interesting. There was a group of about almost 20 people from the community who came and talked about what had happened in Bellingham, Washington, and the county is Whatcom County. So it was really a county-wide approach with Bellingham as the geographical and governmental center. So probably the most important thing that I learned when I went out to the state of Washington is I came out there to learn about the self-healing communities model, which is the term that Rob and Laura Porter have penned. But when I talked to people in those various communities, when they started their work, they were using the ABCD, asset-based community development model, which basically says that as the problem being that sometimes as professionals, we see problems and our job is to solve other people's problems, and we come in with preconceived ideas about what people should do to change. But the ABCD says that you need to leave your preconceived ideas at the door and go talk to people and find out what they need. So now the Washington State folks don't have any problem with the self-healing communities model. That fits perfectly with the ABCD, but they started by talking to people, finding out what their needs are, and trying to work on self-identified needs in communities. So just two of the interesting outcomes from Whatcom County and Bellington, Washington, is they did a survey of parents of school-age children and asking parents, what are your really long-term goals for your children? And what the parents came up with is they wanted their children to be happy and be good citizens. When they asked the children about what they thought their parents' goals were for them, the children said, well, our parents want us to get good grades and go to college. So two different ideas about what long-term goals are. So through an evaluation of different mental models, the school district decided to move away, to revise their mission statement, basically from something like every child will meet the state standards to all children are cared for and respected. So there was a mental model shift, and we'll get into the idea of mental models a little bit later on in the presentation. Now, Longview, Washington is in Cowlitz County, and when I had a chance to visit that community, they again stress the idea of community organizing and community empowerment, that you need to go out and talk to folks in the communities to find out what they want, and you try to go for low-hanging fruit or quick wins. So the particular example that they ended up creating was called Take Back the Light. So the way this evolved is, as they started to look at what's happening in the community, one of the things that they noticed was that during the nighttime, there's very few porch lights on. It was and I'm talking specifically about the Highlands neighborhood in Longview, Washington. So they started asking people, why is that? And they, poverty was part of the problem in the neighborhood, along with drugs and crime and teenage pregnancies and all the rest of the ACEs. But people were not replacing their burned out light bulbs. So they were able to arrange to get a whole bunch of light bulbs organized or donated, and they ended up having an event where they started off with a community barbecue. The light bulbs were handed out. All these residents went home, put in new light bulbs in their porch lights, and they had a turning on the lights ceremony and lit up the neighborhood. And so this Take Back the Light event built relationships and built community and allowed them to move forward onto other issues. So the important, I think, metaphor here is that crime thrives in the dark and crime does not do well in the light. So, and just one related issue or matter that came up in Longview and specifically the Highlands neighborhood was that prior to the community organizing and empowerment effort, the police and the residents didn't have a very positive relationship. So the police started moving towards a community policing kind of model. And as the community organizing and empowerment got going, the police chief reported a lot more calls to the police. But these weren't complaint calls. They were calling saying, hey, there's something going on over at this corner. But they were positive calls to the police, wanting the police to be involved and more involved in the neighborhood, which is a sign of community health. Okay, so now we're going to move into the lessons learned from Washington State. We're going to start off with the idea that an ACEs response requires a paradigm shift in thinking. Then we'll look at facilitating trust and community building. Then we'll look at expanding and sharing leadership. Then at communicating strategically about ACEs and resilience. Then on to evaluating and reflecting on progress, and then celebrating success. So, a term that we have paradigm shift as the terminology up here, but I want to introduce the idea of mental models, because this is a really important piece of the model and of this approach. When I first heard the term mental models, Laura Porter introduced it at a trauma lab event that MCCC sponsored a couple of years ago. And so she gave the example of, first of all, we had to look at, think of the metaphor of an iceberg. Only 10% of an iceberg is above water. That's what we see. And that's kind of like the behaviors we see in people. But 90% of this iceberg is below water level. We can't see it. So this is where mental models lie. So she provocatively offered this as a mental model. Is our mental model about mental illness, that if you're mentally ill, we expect you to live at or below the poverty level and never bother anyone? Provocative question. Probably the biggest mental model shift or paradigm shift that has impacted my life and my presentations is that folks who are high ACEs folks, they tend to get in a lot of trouble. And if you're a troublemaker in society, society gives you the message of what's wrong with you? You keep screwing up. And if you internalize that message and start to think what's wrong with me, that negative self-talk creates a very poor victim kind of psychology. So rather than frame your life experience as what's wrong with me, if instead you ask the question, what happened to me? That puts it up to the prefrontal cortex part of your brain where you do your best thinking. And you can say, yeah, I guess I had a lot of adversity and trauma in my life. It affected my own brain development. But knowing that, I can now plan steps to move forward and change my life. So that is one example of but to me, an important change in mental model. Another example of a mental model shift was when my wife and I went to visit Terry Barilla in Walla Walla. We parked our car and we're walking down to the coffee shop to meet her. We walked by this park. Now, in this park, I want you to think stereotypes here. There were a lot of folks who looked homeless, kind of wino derelicts, very rough around the edges. And so we noted that. And in a later conversation with Terry about mental model shifts, she talked to me about how back, I'm not sure, probably the 1990s, Walla Walla is a big farming community, and they discovered that the climate and the soil conditions were great for growing wine grapes. So a wine industry developed. And as this wine industry is a tourism-based industry, and so as the folks who were leading this effort were developing this, they were seeing these folks in the park and going, this does not look good for tourists coming into town. And they wanted law enforcement to clean up the park. So, but somebody said, well, we should get to know who these people are. So they started interviewing these people in the park. And what they found out was there's a big veterans hospital in Walla Walla. And a lot of the folks there are receiving services around drug and alcohol addiction. And if you are in recovery, the worst thing to do is to stay home. It makes you want to use. So what these folks in recovery were doing was going to the park and using it as an informal AA kind of group. They were getting together in a public space and supporting each other in their recovery. And so when they realized that, they dropped this clean up the park kind of idea. So there are other examples about paradigm shifts, but when I asked people in all three communities, what strategies do they use? They said, the strategies we use, you cannot rely on them work. You need to look at your mental models in your community and work with those to figure out your strategies.
So the second lesson learned really comes from a parent that I had the opportunity to interview named Annette Bovent. Annette has a pretty high ACE score, or an ACE score of 10. And after hearing information at a conference about ACEs, she was able to essentially have an aha moment and change her parenting practices, which helped her build her relationship with her children. And she's been spreading the word about ACEs ever since to get other people and parents informed about this information. And one thing that she had said during our interview was that, quote, when you are working with very hurt and vulnerable people, building trust needs to come before you can shove down their throat so much information that they back away from it, end quote. She suggested that in order to engage people most affected by ACEs, it may be necessary to build trust by inviting them to coffee or going on a walk with them to build rapport first. Peter Pecora, who was the co-chair of APPI at the state level, also emphasized that it may be necessary to repair relationships with community members before you can move into an action phase or encourage people to change behavior. So one thing that he said is that, quote, some communities have been burned by researchers or they've been taken advantage of by foundations or government agencies have been really unfair to them. So keeping that in mind as we're doing this work and trying to make sure that everyone is involved in this process and trying to change behavior, that sometimes we may need to pause first and take time to build trust before we can move to action.
Third important lesson from Washington State was the idea of expanding and shared leadership. So I'm very interest in the idea that how do we share leadership, those of us who are kind of middle class professionals, with the folks who are the high ACEs folks. So I asked about how that went, and it didn't always go well. There was a lot of rough spots along the road in each of the communities, but in each community they said it is essential to share leadership. So folks who are high ACEs folks need to be part of the process and the decision making. Probably the takeaway for me is that the leadership needs to be shared. It needs to be both bottom up, the grassroots approach, and top down. So leaders of programs and agencies, they also need to buy in and be involved in change if it's going to happen. So top down and bottom up. And one of the interesting items for me was when I asked about sustainability. Usually the sustainability question is about funding. Where is the funding going to come from to keep these programs going? But Terry Barilla told me that now in Walla Walla, they're 20 years into doing this work. They're getting around to sustainability now, but their mental model of sustainability is not about money, it's about training. So what they're in the process of doing is getting all the major institutions, the school system, the healthcare system, the criminal justice system, social services, to get a person on staff who is a trainer who will train all of the new folks coming into the system and continue with the ongoing training of folks who are part of the system. So sustainability is about continuing education and support for folks. And again, from the bottom up all the way to the top, everyone being involved in the leadership and decision making.
Thank you. So one of the other key lessons learned that came up in a lot of the different interviews we had with people from Washington State was the importance of communicating strategically about ACEs and resilience. And three main themes came up within that category as subcategories. The first was about focusing on the value of spreading information, as Lowell was just saying, about ACEs, brain science, and resilience to community members, parents, including those most affected by ACEs. And it was important to not only spread that to community, but also to state leadership and local leadership, so that everyone would have a common understanding about ACEs, resilience, and how brain development is affected by experiencing ACEs. State and community leaders worked really hard to spread the word about ACEs and near science in Walla Walla. And Terry Barilla explained, who was again the network coordinator for Walla Walla, quote, "You try to bring that community awareness out there by being at community events. You create opportunities for exposure by parents, and you do fun and engaging things, essentially anything that we can think of to raise awareness to the general public." So it's really about hitting the ground running and spreading the word to the community in all the different ways you can think of. In addition to educating community members and practitioners at the local level, Laura Porter, who was the director of the Family Policy Council, also worked really hard to nurture relationships with state leadership to ensure there was, as she called it, an internal voice within who understood near science in a minimum of 2 out of the 3 main state offices, including the governor's office, the state senate, and the House. And so that was something that they prioritized when they were in operation, was to always engage at least 2 out of those 3 offices and make sure someone in those offices was pretty familiar with ACEs and resilience research and was helping move that agenda forward at the state level. And this was really vital to the sustainability of the programming by keeping those people kind of in the know about this information. And that also helped generate momentum at the state level. The second sub-theme was to allow opportunities for people to get multiple doses of the information and exposures to the information. In order to saturate a community with information about ACEs, the value of getting multiple doses is because sometimes it takes more than one time to hear the information about ACEs and resilience in order to have kind of the aha moment. And before people can fully embrace the urgency of ACEs. And in the interviews that I did with some of the champions of Walla Walla, of the Walla Walla ACE response, such as Terry Barilla and Jim Sporliter. They both said that it took multiple times for them to hear the information until they really understood the urgency. And so allowing not only to saturate information and reach everyone in the community to educate them about ACEs, but also to offer multiple opportunities to learn about it is really essential, because sometimes when people are processing the information, maybe they're thinking internally about how ACEs have affected them and may miss more information about resiliency and the hope piece. And so really bringing in multiple ways that people can understand and engage with that information is an essential part of spreading this information. And then the third sub-theme in the communication theme is really stressing the importance of customizing the information and using a variety of communication methods to get buy-in from diverse audiences. So Dr. Leddington, who was the executive director at the Health Center in Walla Walla, explained, quote, "We get on the agenda in lots of different places and talk about what we are doing. We are busy writing op-ed pieces for the newspaper, and we have met with the editorial staff of the newspaper and have gotten their buy-in on this as well," end quote. So really looking at different ways and strategies to get in different mediums to get this information out across the community was a helpful way to engaging people. And Rick Griffin, who was the executive director of Jubilee Youth Farm, which was one of the places where they did a lot of ACEs staff training, mentioned that it is also essential to show partners how the information about near science is relevant to their work. He recalled that many sectors have struggled to understand how exactly information about ACEs and resilience is affecting them or their work or workplace, and it took a while for some partners, such as the Chamber of Commerce, for example, to get on board. He explained that once the Chamber of Commerce understood that ACEs were more about than just children, and that it actually impacted their staff, such as people showing up late for work or worker turnover, they then began to realize how the conversation actually applied to them. So that's just another important piece when you're communicating. Think about the audience and think about how you can really get their buy-in.
You're starting.
Oh, great. Thank you. Yes. So the next lesson learned was really about the value of evaluating and reflecting on progress. So evaluation of this work can be pretty messy. Evaluating complex community change over the course of multiple generations can be hard. And so I think the Family Policy Council and APPE at the state level did some work to really try to figure out how to quantify the changes at the state level. And they used a mixed methods approach, qualitative and quantitative methods, to explore the effectiveness of the networks at reducing some of those major 7 social problems that were outlined in the 1994 VPA, or that Violence Prevention Act. There were 3 main reports that were produced to look at the effectiveness of this work at the state level. And all of those 3 reports are linked at the bottom of the slideshow or the PowerPoint. One report that was produced by the Family Policy Council, along with contractors in 2009, looked at statewide county trend data from 1998 to 2006, so basically over an 8-year period, and found that the average severity of social problems decreased in the fundings or in the counties that had those networks in place that were funded, while the counties that did not have funding for their networks, the average severity of social problems actually increased over that same time period. So that was kind of a comparison, what they call the natural experiment or quasi-experimental design, to really look at a comparison between places that were receiving funding and doing work around ACEs in their communities and those that were not. Another evaluation that was conducted around the same time in 2009 looked at a projected cost savings based on a projected cost savings analysis. And the report projected that there was an investment, with an investment of $8.1 million in the Family Policy Council and related network activity, that investment of $8 million would save an average of $55.8 million in caseloads avoided. So essentially, people receiving services and supports would not be seeking out, through the ACEs work, would not be seeking out as much chemical health treatment and that sort of thing was kind of their idea, or maybe they would be avoiding going to the juvenile justice system if they were getting support on the front end through prevention efforts at the health center, for example. So they really looked at if they projected that there were some caseloads avoided. And so they looked at a long-term savings actually of about $300 million with that initial investment of $8 million. So again, that was a projected cost savings analysis, but it was another way that they worked to try to quantify how can we tell the public and state leaders and funders the value of this work? How can we try to quantify this? And then a third report that I mentioned earlier was released in 2016. That was a 3-year study that looked at 5 different communities, including 4 that had networks that they were connected to. And those 5 communities, there was a kind of a deeper dive into more of the qualitative methods and surveys trying to understand the community capacity and a kind of how strong the capacity of the community was to respond to ACEs. And so this study stated that, quote, despite modest investments and limited staff, several rural communities in Washington state were able to weave together proven programs and innovative approaches, effectively decreasing the social, emotional, and physical problems linked to trauma. So these evaluations highlighted the value of investing in ACEs reduction at the local level. And now I think Lowell will take a few moments to talk a little bit more about this.
So when I ask people about evaluating their progress, they basically told me that you need to use both quantitative measures and qualitative measures. And some of the very impressive quantitative data in Cowlitz County, which is where Longview, Washington is located, 10-year data from intentional community resiliency building, teenage births down 62%, infant mortality down 43%, youth suicide attempts down 98%, youth arrests for violent crime down 53%, high school dropouts down 47%. So impressive outcomes from community resiliency building. So as important as these quantitative measures are, the other thing that they stressed was really the idea of the qualitative, the reflection when you've just completed an event or a program or a process, is to spend time talking about how that, reflecting and how did it affect you and how did it affect others. So these stories that come out of more of a qualitative approach are important. And a friend of mine who's a researcher, when I was kind of lamenting the idea of bean counters they don't like qualitative stuff, she said that every anecdote, every story is one piece of information. So doing the qualitative reflection is as important as the quantitative data. So the last lesson learned from Washington State is the idea of celebrating successes. So reducing ACEs and building protective factors into communities and organizational life requires a multi-generational approach and will take time to achieve. So again, in Washington, they've been working 10, 20, and 25 years on this already. So it's very important to celebrate the quick wins that you get along the way. They may seem like small achievements, but they need to be celebrated. So Liz from the Longview Community Network reiterated the idea that it was important to go for the low-hanging fruit, the quick wins, and then build on the idea that we can do this. Small successes build to longer successes going forward.
Thanks. And so Laura Porter, who is the director again of the Family Policy Council, also explained if we want to deliver some quick wins to get people really excited, then we have to strategically design our work in a way where at least some of the measurable kinds of things could reasonably occur within 3 to 4 years. But we don't want to limit all of our work to only that, because then we will not get the longer term, bigger outcomes that we're aiming for. But again, we need to prove to people that this work is important. Otherwise, there will not be funding for it or energy around it. And so it's really important to kind of think strategically about supporting both the short-term and long-term outcomes of this work. So it's also really important to take time to celebrate the stories of people who've embedded information about neuroscience into their practice to improve their lives. For example, I did mention during the first lesson learned about trust building that there was a parent named Annette Bovent who had a really high ACE score, and she was able to change her parenting practices and improve her relationship with her children. And she was, around the time that she heard about ACEs, she was experiencing housing instability. And since then, she's been able to move out of homelessness. And she was also able to start a foundation to support other people who were moving out of homelessness, which was really impressive. And she currently is supporting that organization called Hope Heals out of her home. And she was also named a community hero by their local news station in 2016. So it's important to also remember that stories like Annette Boven's help build momentum and can help people recognize the value of developing a community-wide effort to ACEs. So we really appreciate that you stayed with us this whole time. We recognize that we've only scratched the surface of many of the great work that was happening in Washington State. We have provided additional slides that we recommend additional reading at the end of this slideshow. We also want to note that the information we shared is shaped by the state and local context of Washington State, and what worked best in Washington may not lead to the same outcomes in our communities in Minnesota or in other places around the state. Our goal was not to provide prescriptive strategies today, rather to highlight some of the learnings from Washington State leaders who supported local and statewide efforts to reduce ACEs and build resilience. So again, we really appreciate your participation today and welcome any additional questions you may have. I don't know, Lowell. Yeah. So we're now kind of moving into that Q&A portion of the event.
So if any of you have questions, and this is a perfect time, this is great information. Thank you for all of that information. It's very interesting to hear what's happening in other communities. If you have questions, go ahead and raise your hand and I will unmute you, or put your question in the question box and we will get to you. While people are thinking on that, we want to let you know that this webinar is being recorded, excuse me, and will be available on the website, www.pcamn.org.
Okay, I'm gonna just pull this open. Yeah, so I'll pull that.
Do you have some examples of quick wins?
So Barb's question, do you have any examples of quick wins that you can think of?
When I asked Clary specifically what were some of the projects that represented, she said they built a lot of playgrounds. When you're going into neighborhoods that lack something like, a playground is a place for people to go, for children to have a healthy physical experience, and also for people to meet and make connections. So playgrounds were something that were relatively easy to do. And the other project that they recognized early on that needed to be done was to start a mentoring network. So mentoring is a hugely important programming option for communities in my mind. There's that one. And then another example, when Terry said the idea about leaving your preconceived notions at the door, she said, I never would have thought that feral rabbits would be the primary concern of a community. So in one community within Walla Walla County, they had a problem with feral rabbits. And some people, of course, want to just kill or poison them, and other people didn't want to do that. But they ended up basically live trapping them and bringing them out to another area. And that quick win allowed them to develop the relationships to move on to other projects.
And just one other example that was, I think, highlighted in the Paper Tigers movie. But after Jim Spoiler came back from that conference, after learning about trauma-informed practices and discipline, he, instantly started just kind of reframing the way that he talked to students about behavior. And he said immediately once he started asking the question and shifting from the what's wrong with you to what happened to you, he saw students start to de-escalate immediately in his office and start opening up and sharing what was going on with them. And so that was something that he did, one day, it was a pretty easy thing, was just reframing kind of how we approached behavior and asking questions to students. And he was just amazed to see what a profound difference that made.
How far along is Minnesota in the process?
Yeah, so I know Lowell could probably speak a little bit about his work.
Yeah, the way my perspective on the Crow Wing County work is that we've done a pretty good job with educating so far. We've held a number of workshops and presentations around ACEs awareness and resiliency building. I see our work going forward as community organizing and empowerment. That we've not done that work yet. We are hoping to. There's some good signs right now that project may evolve. So that's where I see us being at in Brainerd, Minnesota, and Crow Wing County. We've got a really good start. Lots of very positive relationships have been gained through the work. But there's a lot more work to do. But I'm positive and hopeful about what can happen in our community.
Great. And
Emily, how about the rest of the state?
Yeah, so as the director of the ACE Collaborative Partnerships, I was recently hired in July of 2017 to work with the MCCC and in conjunction with the Department of Human Services. And our goal is to really expand this work or to educate communities about ACEs through their children's mental health and family services collaboratives across the state. So we are just kind of rolling this work out currently. And the goal it's a 4-phase project. And so the goal is really to get information out about ACEs. So essentially do that, make the communities conversant in ACEs, train people to present and kind of hold that information within communities, and so train presenters to talk about ACEs in their communities. And then eventually our goal is to really move to community conversations that will help inform community resilience plans so they can start implementing some changes and develop their own ACE response across the state. So we're starting this project. This project has been supported by the state government. We got funding that was kind of funneled through the governor's budget and approved by the legislature in 2015. And then our funding came through in July of 2017. So there is support for this at the state level, and that's a lot of how this funding came through as well to support this work.
How about what's going on in Minnesota related to state leadership?
So I think part of just the fact that there was this funding that came through for this project to take a statewide look at moving this agenda forward through the work of the Children's Mental Health Collaboratives is indicative of the state leadership and the state support for this work.
How about legislators? Have we gotten a lot of legislators on board with ACEs, looking to get funding, government funding?
So there was so I'm not as familiar with what the buy-in is right now with the legislature, but in order to get the legislation passed back in 2015, there were a lot of educational opportunities to bring legislatures to kind of educate legislators about this. And so the Department of Human Services and representatives from the Department of Health worked together to really educate legislatures. They had sessions where they brought in presenters, including, I believe, Dr. Robert Anda came in and talked to state leaders about ACEs and neuroscience, and then some other like neurobiologists and people from the University of Minnesota who are really moving forward with resilience research. So those folks were all brought in to present to the legislatures to kind of increase the understanding of ACEs.
I think it's important to note that at the local level, talking with local city council, county commissioners, folks who are decision makers at the local level is an important part of the process, because I think state level folks need to know that local level folks are interested in this movement.
What opportunities do you see for Minnesota for this learning?
I didn't understand.
Yeah, so let me just read that again.
Okay, which one?
Oh, I think it's this one. What opportunities do you see for Minnesota from this learning? Might say something.
Similarities between networks.
So that's a good point. So the networks that I talked about that were introduced back in 1994 in Washington State were essentially local collaborations of partners. There were 23 mandated partners as part of those local networks, including community members and practitioners from health and human services and that sort of thing. And so in Minnesota, we have a pretty similar model that we're rolling out with this ACE Collaborative project, where we are working with those children's mental health collaboratives that are also local collaborations of partners, including mandated partners such as schools and mental health, and in some cases, juvenile justice representatives. And so those are kind of, we have similar structures in both, it's a parallel structure to what happened in Washington State, kind of using the networks as the networks in Washington State and the collaboratives in Minnesota to really disseminate this information and to move some of this ACE work forward at the local level.
Specifically to Itasca County, does anyone else know if ACEs has been talked about or started in Itasca County?
Yes, we actually do know.
Can I contact? Okay.
Yeah, talked about or started in Itasca County. Yes, Kathleen, what I'll do is I will follow up with you. We have a regional ACE training coordinator who's located in around Cass County, and she is rolling out some of these ACE trainings in Itasca. And so I will make sure to connect you with her after the webinar.
We need to build better communication with our state leaders. Are there any key people that we should work with moving forward in the state?
So Ruth, that is a great question. There are a ton of champions of this work. And I think one thing that we're working on getting organized right now is kind of connecting all those different leaders so we can really have a kind of a coordinated front. There have been multiple iterations of groups of people that are really trying to move this work forward in Minnesota, including there was one called the kitchen table group who would get together and really just brainstorm ideas of how to move this forward, how to connect partnerships. And I think that, I think there are partners that could really help move this forward. But I don't have any specific names at this point, just knowing that we're trying to kind of get organized to continue to move this.
So I might not say his name correctly, so help me out, Emily. Jim Sporleader will be coming to the Pact for Families Brain Conference this spring in Wilmer, Minnesota. Did I say his name correctly?
I think so. Sporleader, yeah.
Which
systems or sectors might be most receptive to starting system training?
My take on that would be is that folks who work in public health, social services, and mental health, they get this very easily, as does educators. So those are two places that are very good places to start in your community. Pretty easy buy-in by those folks. And then another group that we're just starting to try to deal more with in Brainerd is faith communities. So we actually have a workshop coming up on March 1st that once we have the flyer done, we'll put that up there. But we're inviting clergy and other, I would call them lay leaders in faith communities. So people coming from a faith perspective will basically do the ACES 101 or ACE interface in the morning and then have a discussion using a World Cafe format about how to bring this forward within faith communities. So I think faith communities have tremendous potential. We haven't worked much with those communities yet, but I see that as a huge potential for the movement going forward. I would say employers are also, we're talking about folks who haven't been reached yet, but if we can get employers to be exposed to this information and how it can positively impact their workplace and productivity, that's another, I would call it a need area at this point, but let's do it.
This is a good question, and this is one that I hear often. How was Washington able to engage parents and community members in this work?
I think kind of a short answer is they put in a lot of time to making sure that that was a priority. So I know that Lowell gave an example of, I believe it was Longview, with the lights, kind of the lighting of the
Take Back the Light.
Take Back the Light, yeah. And in that community, in order to really get the buy-in and get neighborhood members on board to participate in the project, what Liz, I believe, was the network coordinator there, and a community organizer in town. And she essentially sat on the hood of her car in the neighborhood for nights on end, just really trying to get to know neighbors and to talk about this at that level. And so it wasn't, so I think building relationships was kind of a big piece of that.
I think the simple answer to that question is door knocking. You got to go out and talk to individual parents and then parents in groups and listen to them. One piece of advice I got from folks in Washington was that the ACEs language sometimes is intimidating right away, and so that you may need to hold off on some of that until you've listened to what their concerns are. Again, the asset-based communities development model, listen to what the folks say they need, and then move on from there.
Mm-hmm. How I think is doing a lot of across the state of Minnesota. Do you want to talk a little bit about that?
Oh, so I'm sorry, Barb, I lost you for a minute.
MCCC is doing a lot of work with collaboratives across the state of Minnesota. Do you want to say something about that?
Yeah, I mean, I think I mentioned that earlier too, that we're kind of rolling out that ACE collaborative project in conjunction with the Family Services and mental health, children's mental health collaboratives across the state. So there are 90 collaboratives across the state that really work at addressing the needs of children and families in the communities. And so right now the project that I'm supporting is really trying to work with those collaboratives to get the information out about neuroscience, about ACEs and resilience research and brain development to those communities, to the practitioners connected with those network or those collaboratives, and also to community members that are connected with those collaboratives as well, and really trying to make sure that we get the word out to people and parents most affected by ACEs. And so that's a big part of our work as we move forward into this next couple of years.
Right. So if they haven't been connected yet, they can contact you, Emily?
Yep, and we have a team of regional staff. So we have staff all over the state who are supporting this this project. And so if you wanted to contact me, certainly you could, and I could refer you to the person who's in your region who's helping coordinate this effort.
Okay, great. Also working with many of the tribal communities across the state as well.
Yep, exactly. And so there is a tribal project that is being coordinated through MCCC as well, where we are currently working, I believe, with it might be 5 of the tribes across the state to really roll out information about ACEs and neuroscience and educate those communities about ACEs and neuroscience. There's also a component about historical trauma that we've also wrapped into this work, because that's a really important starting point before we can start talking about other trauma, is really looking at the historical and generational trauma that has occurred. And so that's one of the components of the tribal work that's currently happening as well. And we're also working on educating communities about historical trauma through the ACE Collaborative Project as well.
Mm-hmm. So Mary is saying about a year or two ago, we spoke to about 600 educators from Itasca County schools on ACEs.
No,
great.
Sarah is saying, talk to 4-H. Our staff could use ACE training.
Thanks for that recommendation, Sarah.
Yeah, and correct me if I'm wrong, but I think in general, there are ACE interface presenters located almost all over the state. So if you're in a community that has not had a presentation, you should be able to find an ACE interface presenter somewhere near to where you are. And again, contacting MCCC if you would be the first step in getting a ACE interface presenter out to whomever your group is.
Thank you. How can we learn more about future trainings and webinars?
Sure. So one thing you could do is I recommend that you connect with your local Children's Mental Health or Family Services Collaborative to see if there are any trainings coming up in your area. You could also check the MCCC website, because we'll be posting information about our webinars and upcoming trainings as well. And the information about how to access that webpage is also connected in the recommended reading section of the PowerPoint handout, which you should all have access to. So in these resources, I've included some publications about the evaluations that happened, the professional paper that I wrote, and then also some additional information about some of the work that happened in Washington State. We also have some blogs and infographics and articles, documentaries, links to those documentaries that I mentioned earlier, and then some websites that will have some really good resources as well about this.
And if you're anywhere near the Brainerd area, you could go to the growingenergized.org website, and that would have, we've got a number of local trainings up and in the works. So, and we also have a team of people who are willing to go out and do presentations in other parts of the beyond Crow Wing County. So if you're close to us, check out growingenergized.org.
Emily, you want to put your contact information back up?
Yep. So, so my information is listed on the questions page now. So I moved back to that one.
So this webinar broadcast is actually being recorded and will be on the MCCC website. Also, this information is in the handouts as a PDF of the slides that were presented. I'm not seeing any more questions. Do you have any closing thoughts?
Yes, hope is the important message. This can be done. So I'm looking forward to learning more myself and networking with all the many very, very good people in our community and around the state. So we can do this. So thank you, everyone, for attending the webinar today.
Yeah, thank you for joining us. All right.
Thank you, both Emily and Lowell. This has been very informative. It's very helpful to hear what others are doing. So we appreciate this very much. We're getting a lot of thank yous coming in. So great job.
Thank you. Have a good rest of your day.
All right. Thank you.